happens when your cat has two diseases. They have one where the organ involved loves water, and a second one where the organ involved hates water. It happens more often than you think, and it can definitely be quite the problem. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. Today we're going to talk about heart disease and chronic kidney disease, which, as I mentioned, happens more often than you would think, and it's definitely a significant problem when we have both of these diseases going on in the same cat. Heart disease can worsen kidney disease can worsen heart disease, and it can just become such a mess so quickly. There's a fancy name for this syndrome that came out of human medicine called the cardiorenal syndrome. It's identified often enough that there is actually 5 different subtypes of cardiorenal syndrome, types 1 through 5. Everything from primary heart disease that causes kidney disease, so an acute injury to the heart that causes an acute injury to the kidney. Another category is chronic disease with the heart that results in chronic disease with the kidney. And then there's even a category that accounts for heart and kidney damage that occurs secondary to other body systems and their dysfunction. So whether or not we have heart disease due to a valve problem, a thickness of the wall problem, secondary to something like heartworm disease, the heart takes primary concern. Unfortunately, both the heart and kidneys are very important organs to the body, but the heart is just a little bit more important than the kidneys. So when we have heart disease and kidney disease, generally we're prioritizing the heart. But the problem there is that the heart does not like excessive fluid or excessive hydration at all. And we have kidney disease present. We're generally trying to not necessarily overhydrate these patients, but the cats definitely need more water to account for what they're losing in their urine because their kidneys aren't functioning normally. And the biggest problem and or offender in this situation is something called the RAS system. This system, while it's incredibly helpful in life-threatening events, can kind of go haywire between the two diseases. And this is generally where our medications come in, that we're trying to regulate everything and again, work against each other. Because it is such a complex system and such a complex disease process, in an ideal world, these cats would have a cardiologist working on their case and they would have a nephrologist working on their case. Now that tends to be a pretty rare situation, but if you can make it happen, that's definitely going to give you the best prognosis for your cat. If you can't, it is what it is. Like I said, it's pretty uncommon that we are able to have both specialties on board managing a case, but if we wanted the best gold standard, that is how you would approach this. A cat that is being treated for both diseases definitely needs close monitoring, close management, and unfortunately there is a decent financial burden there. Similarly to the diseases themselves working against each other, oftentimes the medications that we use work against each other, meaning something like a diuretic for the heart, so a medication that is going to help the heart process excess fluid in the body, tends to harm the kidneys in creating this state of dehydration. So it can actually worsen the BUN and creatinine, it can change our electrolyte values, either increasing or decreasing potassium, which is important in kidney health, or even a drug like pimobendan, which is considered relatively safe and definitely an advancement in heart disease. We don't necessarily know what that does in kidney disease in cats. So the other problem we run into is we're dealing with cats, and there's just not a lot of studies studying heart and kidney disease in cats. So as far as standard protocols, they don't necessarily exist. There's experience, there's theories, there's the science, but there's not a lot of tried and true studies that have been done specifically in cats with heart disease, with kidney disease, and with the medications that we are now using. Occasionally we'll get lucky and something like omega-3 fatty acids will benefit both. The antioxidant effect is good for both heart health and kidney health, but more often than not, we're using medications that play against each other, and the diseases play against each other as well. One of the biggest problems we see with heart disease is fluid overload. So commonly, if the heart is not doing its job effectively, it is not able to disperse water throughout the system. Basically, rather than pumping your blood through the veins, fluid can back up into systems it doesn't belong in. So it can back up into the lungs, it can back up into the chest cavity. It just goes haywire, and we have fluid where it doesn't belong, and obviously the body doesn't like that. Just to make things a tad more complicated, cats also throw a wrench in the plan in that they can have a heart murmur that's considered an innocent heart murmur, so to speak. So cats can develop soft heart murmurs when they are mildly dehydrated, or when they're extremely stressed and their heart rate is really fast. So just because your cat has a heart murmur doesn't necessarily mean it has heart disease. So we have to dive deeper into figuring out, do we truly have heart disease? And tests that we can look at to decide that are things like an electrocardiogram or an ECG, blood pressure, chest x-rays, an echocardiogram, which is a ultrasound of the heart, and there is a blood test value now called a cardiopet-proBNP through specific laboratories. Essentially, we take all of this information and decide, do we truly have heart disease, and then move forward from there. High blood pressure is an interesting dynamic with heart and kidney disease as well. Kidney disease can cause high blood pressure. Heart disease, we can see high blood pressure. We know that blood pressure that is too high for too long will damage both of those organs. But mild high blood pressure can actually make kidney disease look less severe than it actually is. Meaning that increased blood flow to the kidneys can keep the blood values that we're monitoring down, making it look like the kidneys are healthier than they actually are. So when we start regulating the blood pressure, whether it's due to heart disease or due to kidney disease, suddenly sometimes those kidney values will pop up a little bit because we've decreased that blood flow to a more acceptable range, trying to preserve the heart, trying to preserve the kidneys, trying to preserve eyesight for that matter. So blood pressure can be a very unique situation where we really find this balancing act difficult. When we do find ourselves in this scenario where we have both diseases present, management, as I mentioned, can get very difficult, but we do tend to focus a lot on nutrition to see what kind of nutrition can we provide to make the workload of the heart easier and of the kidneys easier. We also tend to use fluid therapy for the kidneys, which, as you can imagine, isn't great for the heart. So if we can encourage these cats to physically drink water or drink their hydration rather than using things like subcutaneous fluids or IV fluids, that's going to be better for the heart in the long run. And there is this common misconception floating around that using fluid therapy with kidney disease will cause heart disease. And that's not quite how that works. We often see cats that are receiving fluid therapy for kidney disease. It will unmask heart disease, because being true cats, they can have heart disease without any clinical signs, meaning they can have heart disease with a normal blood pressure. They can have heart disease without having a heart murmur. Cats are masters of disguise and hiding things like this. So it isn't uncommon that we will diagnose a cat with chronic kidney disease, we will start them on some sort of fluid therapy, and we will unmask heart disease. We won't cause it, but we'll definitely make it show up and come to the forefront, and then we have to tweak our plan as well. Using oral fluid therapy tends to lessen the risk of IV fluids and sub-Q fluids, but the catch is getting it into these cats, whether it's in extra water added to canned food, whether or not it's in products like HydroCare, which is a water supplement offering fountains, ice cubes in the water, whatever it is to encourage your cat to drink more. If we can get them in to take it orally, that is going to be a safer way to get fluids in. Two things that I feel are really important for you to learn as a cat caretaker, not only just in general health, but if you have a cat that has heart disease, is something called a resting respiratory rate. So you want to know what your cat's respiratory rate is when it's sleeping. And that's something that your veterinarian can show you how to do. It's really easy to do at home, but you want to know what that number is when they're sleeping, and you want to keep an eye on that so that if you have this heart disease, kidney disease dynamic, and that resting respiratory rate is creeping up, there is a good chance we have something changing with the diseases, and we may be at that borderline or past that borderline fluid overload therapy. Another thing that I briefly mentioned that is very important to monitor is that blood pressure. We need to keep that in check as much as we can so that we can prevent further damage to the heart and the kidneys. And again, I mentioned eyesight as well. So resting respiratory rate and blood pressure are probably two of my top things that I would want you to keep an eye on. But cats with both of these diseases require a lot of monitoring to keep this balancing act in check and things happy and the cat feeling good. So there's no doubt having both of these diseases requires more follow-up, it requires more veterinary visits, it requires more from you at home. And because both diseases are progressive, there is going to be a point where we just can't maintain this balancing act. Unfortunately, when that happens, it usually either shows up as fluid overload, meaning there's fluid someplace in the body it doesn't belong, or our kidney values get so awful that we can't manage the side effects, that uremic crisis, the nausea, the vomiting, that sort of thing. As more studies are happening for cats specifically in this space, hopefully we will develop better treatment protocols and a better understanding of the medications we use and the side effects they may have on the heart and the kidneys. And hopefully we'll have more optimistic information to give you. But until then, we just don't have a lot of information in this space specific to this combination of diseases in cats. And it's not a great situation to be in. For these cats, it's going to be incredibly important that you stay in touch with a veterinarian that you can communicate with, and or, like I said, get that cardiologist involved, get that nephrologist involved, maybe an internal medicine specialist who is good at both. But stay in close communication so that you can do the best job from your standpoint of managing these, that they can help you manage these, and hopefully we can buy some decent quality of life for your cat.